Did you know that over 80% of adults over 60 die from heart-related diseases, and in many cases, the cause is silently sitting on their dinner plate? According to the CDC, heart disease remains the leading killer among seniors in the U.S., and diet is one of the top contributing factors. Shockingly, some vegetables we think are super healthy can actually backfire, especially when eaten the wrong way or mixed with common medications like blood thinners or diuretics. Yes, the very greens you toss into your salad every day could be putting extra strain on your heart without you realizing it. So if you're over 60, or care for someone who is, you need to hear this. This isn't just about eating healthy. It's about eating smart and safely. Before we dive into the details, don't forget to like, share, and subscribe to Elderly Health Tips so you never miss a life-saving update. Right now, let's take a look at the very first food, one that I believe might already be sitting in your fridge: pickled cucumbers. One tiny pickle, up to 1,000 milligrams of sodium. That's more salt than a serving of McDonald's fries. Let that sink in. According to the American Heart Association, adults over 60 should limit their sodium intake to no more than 1,500 milligrams per day. But guess what? Just 2 small pickles can push you past that, without you even noticing. That's because processed pickled cucumbers are soaked in a brine, loaded with salt, often ranging from 800 to 1,200 milligrams of sodium per serving. Why is this dangerous? Excess sodium increases blood pressure. The CDC reports that nearly 70% of U.S. adults over 65 have hypertension, and most of them don't know how much sodium they're really consuming from small foods like pickles, canned soups, or deli meats. And here's where it gets worse. High blood pressure silently damages your arteries, especially the coronary and renal arteries, over time. It leads to left ventricular hypertrophy. That's when your heart muscle thickens from overwork, which increases your risk of heart failure. Studies in the New England Journal of Medicine show that reducing sodium by just 1,000 milligrams per day can cut heart disease risk by up to 25% in older adults. Let me tell you about Harold again. 72, from Kansas. He thought he was doing everything right. He walked daily, avoided fast food, and even cut sugar. But what he didn't realize was that those 3 to 4 pickles a day, his healthy snack, were quietly sabotaging his blood pressure meds. Over the years, his kidneys declined. His GFR dropped from 78 to 48 in just 2 years, early signs of stage 3 chronic kidney disease. If you're over 60 and dealing with high blood pressure that won't go down, even with meds, swollen ankles, morning headaches, shortness of breath, or frequent nighttime urination, the salt in your daily diet, especially hidden in things like pickled cucumbers, might be the missing link. Solutions that actually work for seniors: rinse your pickles under running water. This can reduce surface sodium by up to 25%, according to a 2022 study in Nutrition Research. Read the label. Look for pickles with less than 250 milligrams sodium per serving. These are often labeled low sodium or no salt added. Try quick pickling at home. Mix vinegar, garlic, mustard seeds, and dill. Skip the salt or use potassium chloride with doctor's approval. Homemade pickles can be 70% lower in sodium. Flavor with fresh herbs. Mint, cilantro, basil, and lemon zest can all bring brightness to meals. No salt needed. Track sodium with apps like MyFitnessPal. Many seniors underestimate their salt intake. These tools help keep it in check. Food number 2, raw garlic. Every year, more than 60,000 older Americans end up in the ER because of dangerous interactions between natural supplements and prescription meds. And garlic? It's near the top of that list. That may sound surprising, right? Because garlic is often praised as a superfood, especially raw garlic. It's antimicrobial, anti-inflammatory, and even cardioprotective. But when it comes to seniors, especially those over 60 who are taking medications, raw garlic can turn from healer to hazard faster than you think. Let me break it down. According to a comprehensive report by the National Center for Complementary and Integrative Health, NCCIH, garlic, particularly when raw, contains organosulfur compounds like allicin and ajoine that inhibit platelet aggregation, meaning they make your blood less sticky. Sounds good for preventing clots, right? Yes, in healthy people. But in people already taking blood thinners, this effect can stack up dangerously. A study published in the Journal of Clinical Pharmacy and Therapeutics found that daily high-dose raw garlic, over 900 milligrams per day, significantly increased bleeding time in patients taking warfarin. And that's not just theory. It's what happened to my patient, Mrs. Langford, 74, from Arizona. She was taking Plavix and baby aspirin after a mild stroke. Then she added 2 crushed garlic cloves to her daily tea because a friend told her it was good for the heart. A month later, she showed up with deep bruises, bleeding gums, and signs of gastrointestinal bleeding. We ran an Indian rupee test. Her levels were nearly double the safe range. She was lucky we caught it in time. Garlic is known to lower blood pressure, and for many, that's great. The American Heart Association, AHA, supports the use of garlic as a complementary therapy for mild hypertension. But here's where the danger lies. Raw garlic amplifies the effect of antihypertensive medications, especially ACE inhibitors, calcium channel blockers, and diuretics. In a meta-analysis published in BMC Cardiovascular Disorders, 2020, researchers concluded that garlic supplements could reduce systolic blood pressure by 8 to 10 millimeters of mercury and diastolic by up to 6 millimeters of mercury, equivalent to many prescription drugs. That's huge. Now imagine combining both a 10 millimeter mercury drop from garlic and a 15 millimeter mercury drop from meds. That's a recipe for lightheadedness, blackouts, falls, and hip fractures, a major cause of disability in seniors. Mr. Henry, 78, a former railroad worker in Ohio, once fainted while gardening after eating raw garlic daily with his blood pressure meds. The fall broke his wrist and led to 6 weeks of rehab, all because of an innocent clove. The FDA classifies garlic as a dietary supplement, meaning it's not strictly regulated. That's why natural doesn't always mean safe. The Mayo Clinic also warns patients to stop taking garlic supplements at least 7 to 10 days before any surgery due to bleeding risk. If that applies before surgery, imagine what daily consumption does when mixed with meds long-term. Smart garlic tips for seniors. Cook it lightly. Cooking garlic reduces its blood-thinning potency, but keeps flavor and some antioxidant benefit. Roast, sauté, or bake. Don't just eat it raw. Limit raw garlic to 1 clove per day maximum. That's about 2 to 3 grams. Safe for most seniors not on blood thinners. More than that? Risky. Always tell your doctor, especially if you're on meds like warfarin, clopidogrel, aspirin, or high blood pressure drugs. Garlic is a medicine, and it deserves the same respect. Switch to garlic powder or aged garlic extract. These forms have more stable effects and fewer interaction risks than raw cloves. Harmful food, number 3. Spinach. 1 bowl of cooked spinach can cancel out your blood thinner and quietly raise your stroke risk. Yes, just 1 bowl. That's how powerful this so-called superfood is when mixed with medications like warfarin. Now let's dig into what really happens and what you can do to stay safe. Why spinach becomes risky for seniors on blood thinners. Spinach is loaded with vitamin K1, a nutrient that plays a key role in blood clotting. In a healthy person, that's a good thing. It helps wounds heal. But for people taking anticoagulants like warfarin, Coumadin, too much vitamin K can reverse the effect of the medication, making blood more likely to clot. This raises the risk for stroke, pulmonary embolism, or deep vein thrombosis. According to the U.S. Department of Agriculture, USDA, 1 cup of cooked spinach equals 885 micrograms of vitamin K1. That's over 700% of the daily recommended value. To compare, kale has 550 micrograms per cup. Broccoli has 220 micrograms per cup. Lettuce has 60 micrograms per cup. So spinach, it's the heavyweight in this category. And here's the tricky part. Vitamin K doesn't behave like other vitamins. According to the FDA, warfarin's effectiveness is directly influenced by fluctuations in vitamin K intake. It's not just about eating a lot. It's about eating a lot suddenly when your dose has been stabilized. The International Normalized Ratio, INR, is the gold standard for monitoring blood thinning levels. Normal INR for someone on warfarin, 2.0 to 3.0. Below 2.0 equals blood too thick, higher clot risk. Above 3.5 equals blood too thin, higher bleeding risk. Studies from the National Institutes of Health, NIH, show that even a 250 microgram per day change in vitamin K can swing INR by 1 point in sensitive patients. That's less than 1/3 of a cup of cooked spinach. And these swings are especially common in older adults due to slower liver metabolism and medication interactions. What organs are at risk? If spinach offsets your blood thinner, the following complications may occur. Brain. Ischemic stroke or transient ischemic attack, TIA. Lungs. Pulmonary embolism from clots traveling from the legs. Legs. Deep vein thrombosis, DVT, swelling, and pain. Heart. Higher risk of atrial fibrillation. Related clots. Eyes. Retinal vein occlusion, especially in diabetic seniors. What should seniors do about spinach? Here's what I recommend to my patients. Be consistent. If you've always eaten spinach once a week, keep doing that. The key is consistency, not elimination. Track your vitamin K intake. Use free apps like MyFitnessPal or Chronometer to track weekly vitamin K levels. Try to stay within a 20% range from week to week. Talk to your doctor before changing your diet. Planning to start green smoothies every morning? Or cutting out greens entirely? Your warfarin dose may need to be adjusted. Don't fear spinach, just respect it. Spinach is great for bone health and eye health. The problem isn't spinach, it's sudden change in vitamin K levels without medical oversight. If you're on blood thinners and eating spinach regularly, call your doctor if you notice easy bruising or bleeding, sudden dizziness or weakness, slurred speech, pain or swelling in the legs, vision changes. Any of these could mean your INR is out of range, either too high or too low. Harmful food number 4. Red chili peppers. Red chili peppers contain a powerful compound called capsaicin. It's what gives them that fiery kick. But capsaicin doesn't just heat up your mouth. It also stimulates your sympathetic nervous system, which ramps up heart rate, blood pressure, and adrenaline. That's fine for young folks. But if you're over 60, especially with a heart condition, it's a different story. Let me tell you about Marvin, a 70-year-old retiree from Texas. He loved his spicy food, chili con carne, hot wings, you name it. One night after a spicy dinner, Marvin started feeling his heart flutter. His wife thought it was anxiety. But the next morning, he was dizzy, lightheaded, and his Apple Watch showed a resting heart rate of 125 beats per minute. Turned out he had paroxysmal atrial fibrillation, a type of irregular heartbeat that had been triggered by his high-spice diet. And no, Marvin had never had any heart rhythm issues before. A 2017 study published in the Journal of Clinical Hypertension found that capsaicin can cause short-term increases in blood pressure and heart rate, especially in people over 65. The American Heart Association, AHA, warns that spicy foods stimulate the release of catecholamines, those fight-or-flight hormones that raise heart workload. And according to the National Institutes of Health, NIH, chronic capsaicin intake in large amounts may irritate blood vessel linings and contribute to low-grade vascular inflammation, a hidden risk factor for heart disease in the elderly. If spicy foods are a regular part of your life, here's where the damage may show up. Heart, palpitations, arrhythmia, elevated blood pressure. Brain, headaches, risk of stroke due to vessel constriction. Vessels, chronic inflammation increases long-term risk of plaque buildup. Nervous system, overstimulation can worsen anxiety, insomnia, or fatigue. If you're 60 or older and regularly eat spicy food, watch out for heart fluttering or skipping beats, flushing, sweating, or lightheadedness after eating, shortness of breath or chest tightness, nausea or GI upset with palpitations, high resting heart rate, above 100 beats per minute. These are signs your body's overreacting to stimulation, and your heart may be struggling to keep up. So what can seniors do instead? Switch to gentle spice alternatives. Use warming flavors like fresh ginger, cooked garlic, cinnamon, or rosemary. They add flavor without overstimulating your heart. Cut back gradually. If you're used to heat in every meal, don't quit cold turkey. Instead, reduce the amount week by week. Your taste buds will adjust. I promise. Try paprika or sweet red peppers. They offer the color and aroma without the burn, and are rich in vitamin C and antioxidants. Drink milk or eat yogurt with spicy meals. Dairy contains casein, which neutralizes capsaicin and may reduce its irritating effects on the stomach and vessels. Spice is like caffeine. A little is fine, but too much can stress your system. Especially if you're already on heart meds, blood pressure pills, or dealing with irregular heartbeat, it's worth taking a closer look at what's hiding in your chili bowl. Harmful food number 5. Raw bean sprouts and other sprouts. Between 1996 and 2020, more than 50 major foodborne illness outbreaks in the U.S. were traced back to one surprising culprit: raw sprouts. That's right. Not undercooked meat, not fast food, raw sprouts. And while they may look harmless, for people over 60, they could be one of the riskiest healthy foods on the plate. Sprouts grow in warm, moist environments, ideal for plant growth, and perfect for bacterial growth too. Unlike surface bacteria on lettuce or apples, sprouts can become contaminated from the seed, and bacteria like E. coli, Listeria, or Salmonella can grow inside the sprout, making them nearly impossible to wash away. According to the Centers for Disease Control and Prevention, CDC, since 1996, more than 2,600 people in the U.S. have gotten sick in 50-plus reported outbreaks tied directly to raw or lightly cooked sprouts. These outbreaks were mostly caused by Salmonella, 78%, followed by E. coli, 16%, and Listeria, 6%. Nearly one-third of the patients were over 60, and this age group had a significantly higher hospitalization rate. The Food and Drug Administration, FDA, states that sprouts are among the top 5 riskiest foods for seniors, pregnant women, and those with weakened immune systems. As we age, the immune system naturally weakens, a condition known as immunosenescence. According to the National Institutes of Health, NIH, seniors produce fewer immune cells and respond more slowly to infection. Foodborne pathogens that would cause a mild stomach upset in a younger person can lead to life-threatening complications in older adults. A 2020 report from the Mayo Clinic highlighted that adults over 65 are 4 to 5 times more likely to be hospitalized for listeria and twice as likely to die from foodborne infections compared to younger adults. Let me share a case from my own clinic. Mrs. Edna, 75, was active, sharp, and loved her clean-eating lifestyle. Every day she made a salad with raw alfalfa sprouts because she believed they were pure and detoxifying. After 3 weeks of doing this daily, she started to feel fatigue, chills, and mild cramping. She thought it was just a stomach bug. But things escalated fast. She fainted one morning and was rushed to the ER. Blood cultures revealed Listeria monocytogenes, likely from the sprouts. Worse, the bacteria had entered her bloodstream and infected the inner lining of her heart, a condition called bacterial endocarditis. She needed 14 days of IV antibiotics and 3 months of recovery. She had no idea that raw sprouts could have done that. If you're over 60 and recently consumed raw sprouts, pay attention to low-grade fever or chills, nausea or mild abdominal pain, dizziness or lightheadedness, muscle aches or joint pain, fatigue that lasts more than a day, sudden confusion or shortness of breath. Even if symptoms seem minor, don't ignore them. Listeria can take up to 70 days to show signs, especially in seniors. Practical tips to stay safe without giving up on healthy eating: always cook sprouts before eating. Sauté, stir-fry, steam, or add them to soups. Just 2 to 3 minutes of heat kills most bacteria. Avoid raw sprouts at salad bars or sandwiches. Ask your server if sprouts are raw or cooked. Most are raw unless you request otherwise. Don't rely on organic or homegrown labels. Bacteria don't care if it's organic or from your own windowsill. The risk comes from the moisture plus warmth, not the farming method. Use other crunchy alternatives. Try shredded cabbage, steamed green beans, lightly cooked mung beans, or even roasted chickpeas for texture. Boost immune defenses naturally. Seniors should focus on gut health with fermented foods like kefir or yogurt, adequate vitamin D, and staying hydrated. Raw doesn't always mean clean, especially when you're over 60. What fuels you in your 30s could floor you in your 70s. Sprouts aren't evil, but they're not worth the risk raw, especially when there are safer, equally nutritious ways to enjoy them. As we age, even the most innocent-looking foods, a handful of sprouts, a spoonful of raw garlic, a little spinach on our plate, can quietly put our heart, blood, or immune system at risk. It doesn't mean we have to fear food, but it does mean we need to eat smarter, not just cleaner. Every bite matters. So take a second look at what's on your plate. Cook what needs cooking. Ask your doctor when in doubt. And never assume natural always means safe. If this helped you rethink your food choices, don't keep it to yourself. Tap like, share it with a loved one, and hit subscribe to Elderly Health Tips. Your next meal might just save your life or someone else's.